The table will be turned like this. This is how we set up the table with the stealth head. Just remember that the writing goes as you would normally read it. And because it has this big bump here that's hard, we just put this rolled towel right here so that the patient's not laying on that bump. Okay? And then I just run the cable down to the end of the bed until we can hook it up. Because the bed, some of the anesthetists like it normally, and some of them won't let us just keep it turned like this. Camera goes at the head. Dr. Mondin will be sitting on the patient's right side here. Your mail stand is going to end up here because your camera and your light cord are going to get draped over it for Dr. Mondin to use. Once the patient's asleep and we're setting up, this monitor is going to come in here, and you're going to have to remember to lower it because he'll be sitting. Okay, I'm going to put it up just because it's guiding day today. And then your stealth monitor, which is your image guidance, is going to come in beside that when we're all set up. I just kind of put, this is the table you're going to work off of. If he's doing a SR TURBS with his FESS, you're going to need your SR pan. This is just how I set my table up because then I can work right here and I'm sitting right here as well, and then I can reach all my things. So I put my sector set here, I'll put all my little bowls here, and then I put the Sinus set here so that you can just pull things off of it. Basin will go here. I put the little table here just for when we get setting up, because what I do, because noses are not sterile, I know we're not supposed to flip things, but what I'll do is I'll open this big set on here so that I have a sterile drape, and I'll just start opening, and then your scrub nurse can just pull things to have time to set up. So just leave your sterile thing here and just move things over. Okay. The stealth monitor. I know some of you guys need help with this because it's our newer one. So it unlocks right here and the screen will come up, and there's your on button. You're going to plug it into the wall for your power, and your yellow cord goes up to the fusion there, and that is to pull the CTs from the image guidance system into here. This pulls out, and Dr. Mondin does like the mouse. It gets stored in here, and I find all the time that this is left out with the mouse on it. So we could just remember to put it away at the end. So he likes the mouse. It can go in either of those. Your password is stealth. It's right here on the machine. So you just have to put it in. And then it comes up as ENT. So you're just going to push ENT. We're just going to hit, can you guys see okay? You're just going to hit standard profile, and then you're going to go to standard FESS, because that's what the only thing that Dr. Mondin does. And our old one, we used to have to call and say, can you push it over from CT? But now we can actually pull from the network. So after you put a patient's name in here and search, you want to pull it from the network. It's going to give you a list of scans. You want to pick the one that says bone and the one that has the most slices, because there will be 3 or 4 different scans on there. Okay, so it'll say bone and it'll have like 294 slices. If you have one that just has 60 slices, that's not the one he wants. It's got to have the most. Any questions about this guy? Once you get your scan pulled up onto here, you can unhook your yellow cord because it's already in the machine. You don't need to keep that to the wall. And then, as I said, once we get started, this machine pulls up beside here, and then Dr. Mondin will show you or tell you what to push on here as he's marking and getting it all ready to go. Your pieces, in right here, okay, to the blue to blue. And then all your cords that he uses with the monitoring system hook into these. And it doesn't matter which one you put them into, they all run the same. Okay, anybody have questions about the stuff? And then it shuts down like a normal computer. It'll say end program shutdown system, and you just hit yes, and then it'll shut itself down. Okay, some of the equipment that we need to use for the FESS, I just grabbed. You need your instrument tracker, and you need, this is our new patient tracker. This is the one that goes with this because we no longer need that arm that went on the side of the bed with our old system. So this just goes on the patient's head. Dr. Mondin will put it on there. And then it'll hook into those side ports, as I said. And this one will go onto your back table to hook onto your fusion and all of his other instruments that are in that pan. Okay, so he will use this rotatable fusion TriCut 13 that hooks into the stealth monitor. So this is your straight 0 degree. He will use the 0 degree debriders with the 0 degree scope. So just think of your sinuses as he's going up. He uses the straight instruments. He uses the 30s and the 45s together. So you're going straight, you're going halfway, and then you're going all the way. So that's how I try to think of it, because our 30 degree scope goes with our 40 degree instrument. They don't match up. So just think straight, halfway, and 90 degrees. And then we have our 3 lens cleaners that go with the InstaClear, which is what I understand you guys are having an issue hooking up. So you've got a 0, a 30, and a 70 that match our 0, 30, and 70 degree scopes. These things are easier to get on if you get them wet. So if you can get your circulator to pour your water in your little bowl, because you're going to have your basin full of drapes and things, then you can dump them in and it's easier to push them on the scopes. These hook into your InstaClear tubing. Okay, and we're actually going to hook this up because this has been the issue. Now, we've had some problems with back orders. So if we don't have the InstaClear and we have to go back to the Endoscrub, this is your Endoscrub tubing, okay? And it goes into your Endoscrub on this machine. But your InstaClear tubing goes down in this machine. I've straightened all these machines out because somebody keeps turning this one sideways and pushing it up to the bed. What that is doing is it's causing people to put this in backwards because they're reading the picture backwards, and then it doesn't work. So please just leave them all straight. I've set some room between them, and hopefully it'll work. Okay. So this is extra for when we don't have the normal ones. Okay, so I'm just going to open the Endoscrub or the InstaClear tubing so that you guys can get a feel how to hook all of this up. You will need 2 suctions, so that's why I've got this draped here. But we can probably just move it now and get it out of your way, so you guys can see this. Okay. So you're going to have a couple bags of 500 saline. This is your tubing that goes in your micro debrider. It hooks in right here. These things, any of our equipment that has these with the little rollers should always stay closed. And the reason for that is if they're left open, dust gets in there, and then these don't function correctly to move the fluid through. So that's why I've got on here, please keep closed. That goes for the endo stuff as well that have these rollers. So flow direction towards patient, so it comes in the back and goes to the front. And you want to use as least tubing as you can, because this tubing isn't all that long to reach where Dr. Mondin's working. So I try to leave him as much as I can. And this is going to go in here. Would you go grab me? We're going to have to open a handpiece or this isn't going to show anything. Please. So that's how your InstaClear goes in. Your roller clamp stays up here with Dr. Mondin so that he can use it when he's retiring and put it up and he doesn't get wet. Okay. Now, your InstaClear tubing. This is the end that goes off to you. It has, thanks, Carly. Goes to your bag, and it also has a suction on it. You'll notice on the InstaClear, there is a picture. And the picture is going like this. So when you turn this machine around, people are hooking it up like this. So make sure you're going the way the picture goes. Here's your Y, goes in that way, okay? I put the blue piece in first. It just goes around the top, into here, push your button in, and put it down in. Then this goes to your suction. And I think that's partly why people have turned that machine, is because then your suction doesn't have to cross each other. But it's confusing everybody doing that. And then this guy is gonna go in this way. You want to make sure they're not pinched on each side. Same with this one. And then you're going to hook up to your fluid. Okay. Now you're going to have your microdebrider handpiece. So we need to plug it in or we're not going to get any of our parameters here. So you're going to plug your handpiece into one of these guys, and then it's telling me I need to connect the foot switch because I unconnected it to show you guys. Throw it onto there. When the doctors were away, I had Anita take all of these hand pieces upstairs and set them to default the settings that Dr. Mondin likes, okay? So they should all come up to 3,000 RPM. The pump should be set on 20, and this should be on oscillating. This was defaulting to the forward, which is for the drill, which is part of the problem that you guys were having. And then somebody came in to try to fix it, played with the settings, and then when we plugged it in, it kept just going to forward. So you want 3,000 RPMs, pumps at 20, and you want it on oscillating. Okay, so that's for your straight shot, your microdebrider. If you have to use the endo scrub because the InstaClear isn't working, it's these settings down here, okay? Any questions so far?
Are the endo scrubs the default settings as well?
He likes it at 5, so I don't think she set those because we don't use it that often. But I've never had an issue with that one changing, so it should be good to go. This hydro debrider that's up here, we have 2 hand pieces for this. They're in the room of doom on the bottom right shelf. There's 2 different angles of them. He uses these very rarely, but they're for when he's going up high in the sinuses and the, what do I want to say in a nice way, the sputum stuff up in there is very thick. He can't get it out with this, so that thing has a higher vacuum on it. So if it's very thick drainage up in there, this is what he will use, and it hooks up the same way, just through and out to him.
And is that water or saline?
This is
For the
Oh.
hydro?
it's all saline. Yeah,
Because
I've only used it once or
I
twice.
think we used to have to use water. There was one where we did water and
Well, it could be. I'm pretty sure we just do saline because it's all going to the same place, right? Up in the nose. And then you need. Go ahead.
Just to confirm, if this is not available, then we use this endoscrub on the top section
Yes.
with another bag of saline.
Well, you would use
It would
this
be
one.
replaced, yeah.
Okay, so you would still always have 2 bags of saline running. And often if there is a lot of thick stuff in there, you need to watch because he will go through a bag of this. So now you can see.
Endoscopic.
This is the straight shot. Right here.
This should run itself. The right pedal here. No, this is the one I need. Nope. That's the hybrid debrider. I got the right one. This should run itself. If Paula did it correctly. Okay, any questions at all?
So it's only ever just the straight shot?
Yes. Yeah, if he's using the oscillator, that's when he's doing tympanomastoidectomies, that's the drill. So the straight shot is the one for the noses. Would you guys like to try loading these?